Alright, so we've got a case of groin recurrent pain, and he's an athlete. He's from Spain. And
Former athlete now.
yeah. So Shane has been getting his groin pain since 2 years.
You're talking about the Simla Einstein?
Yeah, the Simla Einstein.
That was 2011.
So he started with this problem, facing this problem since 2011, and it was on and off, getting off pains, on pains on periodic basis.
2 years.
And since past 2 years, he is getting recurrent pains on a frequent basis, right?
This is for the last 6 months. Yeah.
So okay, so the current scenario is from past 6 months.
6, 7 months. Yeah.
So the pain aggravates, it comes down, but it stays over there. So what we can see is there is an evident tightness over here in the inner thigh area. Okay, let me just lower it down. Yeah. So there is an evident tightness in the inner thigh area, and if you can see, thank you. So if you can see that you can see a clear bulge, a clear tightness or a strand which is extra tightened over here. And if in case you feel that you are unable to feel the tightness on the muscle bulk, how you can isolate the tightness is place the heel on your waist area, right? Ask the patient or the player to just exert the pressure on the heel mildly. Okay, the moment he exerts the pressure, you would be able to see the tightness or the bulge relax, right? So this is it. In athletes, it's pretty evident and clear that you get to see the hamstrings pretty easily because it's got a nice built and developed. So there's a clear bulge of bulky muscle in the hamstrings. So that's a compliment. Yes, that's a compliment.
Yeah,
so your hams are good. So the hams are good, and over here, if you will just dig in the midsection of the hamstrings and the quads, you will be able to feel the entire muscle belly of adductor magnus. All right. So over here, there is a tightness of adductor magnus and adductor longus as well. So the procedure which we will carry forward in this scenario is, we will isolate it, we'll do some soft tissue manipulation, we'll do some manual manipulations, and we'll be applying the kinesiotape to overshed the load, right? So offload karna zaruri hai because we are working on the recovery. So the moment strain and stress goes off, we'll be able to proceed with the recovery faster. Second thing, the trigger points on the adductor magnus is on the midsection of the thigh and the iliac crest. That is the origin of the muscle. Make sure you're pretty clear and confident while handling such cases because you are touching the private areas of the player, be it male or female. And if you're not clear, if you're not confident, and if you're not aware of the situation, you might land up creating controversies.
Yeah.
So
Safe.
it's better to be safe, right? So to make things perfectly clear, ask the patient to place his hand on the private area so that you are safe, and whenever you are palpating or examining, the feeling or the touch is appropriate, right? Always whenever you're examining, use the broader part of the hand so that you feel the entire stuff, entire muscle area.
I think if I can pinpoint the pain, that would be...
Yes, that's actually on this area because the adductor magnus and the longus, they come from here only. This is the course of the muscle, right? So now what we are doing is, we will be first doing the soft tissue manipulation. All right. So just relax. Just let me know when you feel uncomfortable or any kind of discomfort. And see how the range keeps improving and increasing. Okay?
The range of
The range of your hip.
flexion.
Yeah. Right now we are almost at 90 degree, right?
Right.
The moment you feel stress or strain, just let me know.
Yeah. Like extreme stress, right?
Any kind of stress. So the soft tissue manipulation should be done from the time frame from 30 seconds to 2 minutes. So you can do it till the extent of 2 minutes as well. How are you feeling?
No.
Normal?
Just the fingers are a bit.
That's okay. Any kind of stress or strain in the groin or something? Feeling good? So we have gone beyond 90, you know that?
Okay. Is it?
Yeah, see? And now we are again
Okay, no.
we are again proceeding, see?
Right. ठीक है. Pain नहीं है.
Pain nahi hai na? So this is somewhere close to 120.
This is called a soft tissue massage.
Soft tissue manipulation. So what we are doing is we are manipulating the sword or the tightened muscle area, okay, to relax it, giving a counter stretch, and we are giving a massage sort of,
Right.
so that the absorption goes
Doesn't
higher
it
and better.
automatically get relaxed when the
It should,
when the
but when the
when
trigger
body is
areas
at
get
rest?
so it should get relaxed, but when the trigger areas get irritated and they get sored, so because of the injury or a lesion, okay, these sorts of tightness they come in because the muscle seems that it's getting weaker. It stays into contraction, it forgets to get relaxed.
Right. So are there any foods that help overall? You know,
Anti-inflammatories. There are foods which have an anti-inflammatory effect.
you mean antioxidants or anti?
Anti-inflammatories. See, we've gone
135.
to almost the full range of the hip.
So pain assets.
Perfect. So now I want you to just get up and walk a bit and feel how are you feeling, what is the difference.